Let's talk about bacterial vaginosis. Do you know that your vagina has a mixture of all different types of bacteria? However, these bacteria are what we call commensals. They learn to live with each other and they're actually quite useful for the vagina. But then it becomes a problem when you've got overgrowth of bacteria in the vagina and you might start having symptoms such as a smell or discharge. And one of the common conditions that can result due to this is called bacterial vaginosis. Typical symptoms of bacterial vaginosis include a fishy odor or smell, a thin, watery vaginal discharge. It is quite unusual to get itchy or soreness, but some women can feel that the vagina might be slightly itchy or sore. But if you have any other symptoms such as abnormal vaginal bleeding, pain during intercourse, or bleeding after intercourse, or abdominal pain, this might not be bacterial vaginosis, it might be a sexually transmitted infection, so it is always good to get it checked by a doctor. Bacterial vaginosis can also be common in women who smoke, vaginal douching, if you're on the coil such as the marine coil, or you might be someone who uses bubble baths or shampoos in the bath. Now, one of the common questions is bacterial vaginosis a sexually transmitted disease? Now, a study had shown that bacterial vaginosis is actually more common in women who are sexually active as opposed to women who are not sexually active. However, there have been cases of bacterial vaginosis in non-sexually active women, which leads to the concept that though bacterial vaginosis is common in sexually active women, it is not a sexually transmitted disease, but it is a sexually associated infection. So this means that you can actually get bacterial vaginosis through sexual intercourse, but you can also get bacterial vaginosis without having sexual intercourse. And like I said, if you're using shampoos, douching, bubble baths, antiseptics, smoking, then you are prone to getting bacterial vaginosis. In terms of diagnosis, the symptoms are quite typical. If you have a fishy smell, thin watery discharge, it's most likely you have bacterial vaginosis, but if in doubt, you might want to see a doctor who can then do some vaginal swabs, which are usually sent to the lab, or your doctor can also check the pH of the vagina. The normal pH of the vagina is between 3.5 to 4.5, so any values above 4.5 is likely to be bacterial vaginosis. There are other conditions similar to bacterial vaginosis, such as a sexually transmitted infection called trichomoniasis, which can also have a raised pH of above 4.5, and vaginal swabs would usually help to distinguish between trichomoniasis or bacterial vaginosis. And some women tend to get a greenish discharge with trichomoniasis as opposed to the clear, thin, watery discharge you get with bacterial vaginosis. There are also over-the-counter test kits that you can get for bacterial vaginosis, and usually you see a change in the color that tells you this is bacterial vaginosis. Now, one common route of getting bacterial vaginosis is actually through anal sex. Studies have shown that this bacteria called Gardnerella vaginalis is quite common in the rectum. So men who do anal sex with women, what happens is if you have anal sex with your woman, you're actually going to transfer the bacteria to the vagina if you then proceed to have vaginal sex. See, now you've got the fecal vaginal route of transmission for bacterial vaginosis. So one good way of reducing the risk of bacterial vaginosis is actually by the use of condoms. Otherwise, in terms of treatment, the first line treatment for bacterial vaginosis is an antibiotic called metronidazole, which is usually given as a 400 milligram dose twice a day for 7 days, and this comes in a tablet form. In some cases, you might have 2,000 grams given to you as a one-off dose, but this is not recommended in pregnant or breastfeeding women. Other options, if you're not able to take the metronidazole antibiotics, would include the intravaginal metronidazole, which is given as a 0.5% metronidazole gel. Again, this is taken once at night for 7 nights, or intravaginal clindamycin gel, which is taken once at night again for 7 nights. Now, if you're pregnant, you can also take metronidazole tablets. However, this is not recommended in the first trimester. While if you're not keen on taking tablets during pregnancy, the other option will be to use the intravaginal clindamycin gel, which is actually safe in pregnancy. Now, there are concerns about does bacterial vaginosis actually cause a miscarriage in pregnancy. There is no great evidence that if you have BV, you can actually miscarry in pregnancy. However, it is advised that if you do have symptoms during pregnancy, you should treat your infection. And there's also reports that bacterial vaginosis in pregnancy can also lead to an increased risk of preterm births as well as premature rupture of the membranes. So I hope you've understood this video on bacterial vaginosis. If you have any other questions, let me know.